Hello, everyone. Welcome to another episode of Unstoppable Mindset. Our podcast today is going to be, I think, an interesting one by a lot of standards. Our guest is Marvin Ross. Marvin deals a lot with mental illness, but he's written books. He's a psychiatrist, and he has provided, I think, a lot of help for people, especially in the world of mental illness. And we're going to talk about that as we go through the day. So we'll get there as we get there. I don't want to give anything away. And besides that, I'm not sure how much I know. Anyway, I want to welcome you
If
all.
I may correct you on one thing.
Psychologist?
And I'm not a psychiatrist
Okay, psychologist?
or a psychologist.
Oh, I thought you were a psychologist. Okay, well, the way I read it wrong. Well, then he is a not psychiatrist or psychologist.
Okay.
And with
I've
that
been
in mind,
called a lot of things,
Ooh.
but not a psychiatrist.
well, is that a good thing or a bad thing?
Well, depends.
Well, Marvin, welcome to Unstoppable Mindset. We're glad you're here.
Thank you. My pleasure.
Well, I've been looking forward to this for a little while, and I guess I read notes wrong. Well, that shows what I know. Anyway, I told you I didn't know much. Anyway, I'm glad that you're with us, and we're really anxious to chat about all the things that you'd like to talk about. Why don't we start with the early Marvin? Tell us about you growing up and all that.
Okay, well, I was born in Toronto, grew up in Toronto. I have a master's degree in criminology, which is a little different than what it is that I'm doing now. And I worked in research and planning and statistical analysis, but I always wanted to write. And so early on, as a sideline, I began writing. My early stuff was a bit satirical and humorous. And then, I don't know, maybe I lost my sense of humor. I'm not really quite sure what happened. But I fell into medical writing. That's kind of a long story. And I guess I wrote a book on Alzheimer's disease in, I guess, the late 80s. And then I began writing medical material for lay public in a number of newspapers. And then at the same time, I was writing for medical newspapers to inform doctors that also sold pharmaceuticals. And I continued writing books, so I did a book on ophthalmology with quite a famous, in his mind anyway, ophthalmologist from Montreal. And I just kept going. Then, I guess in the late 90s, my son, at about the age of 19, developed schizophrenia. And so I started focusing on mental illness. And I've written a couple of books on serious mental illness. I've written for a number of publications on severe mental illness. And then I started publishing books on the same topic. I actually published my own book on schizophrenia first in 2008. And it did reasonably well, at least it got good reviews. And people with stories came to me with book ideas, and technology had advanced to the point where it became very feasible to publish good quality books, both in terms of the printing and the writing, reasonably inexpensively. And so I sort of converted my writing company into a publishing company and brought out quite a number of books. Many of them have done extremely well, at least in terms of reviews. And my writers have all gone on and received accolades throughout North America and Europe for their books. So I really saw my focus of trying to bring light and understanding to a medical condition that is not all that well understood.
Mm-hmm.
Better today than yesterday, but still have a long way to go.
I hear you. A question before we get to the serious stuff. My first time to Toronto was probably in late 1979, early 1980. While you were there, did you ever go to a restaurant called Mr. Green Jeans?
Oh, yes, I remember that.
Here comes the fudge. Yeah. I liked Mr. Green Jeans.
Yeah, I don't think it's there anymore.
That's what I heard. I'm so disappointed.
If you don't mind my diverting a bit, since you raised it.
Since I started it.
You started it. When I was in university, a friend of mine, we must have been crazy. We drove his, I think it was a 1957 Volkswagen Beetle, all the way down to Guatemala City.
Oh my gosh.
And we were crossing back from Guatemala into Mexico, and I got us lost, so we crossed at this very small border crossing, and the border guard wanted our visas. And of course, we didn't need visas in those days. And I guess I was stupid. I didn't realize he probably wanted, $5 or $10 American bills slipped to him. So he made us go back across the border to the Mexican consulate in this little sleepy town. And the consul looked at my passport and he got very excited and he said, "Oh, Canada, you're from Toronto." And he said, "Do you remember the Club 1-2?" And he ran in the back room and he got a swizzle stick from the bar to show me. And anyway, he allowed us to cross back into Mexico without having to pay any money.
That's pretty funny. Yeah, I enjoy going to Canada. It's been a while since I've been to Toronto, so I'm hoping to have the opportunity to come again. But I did hear that Mr. Green Jeans is no longer there, which is sad.
Yeah, restaurants don't last long.
No, not as long as sometimes we'd like. Well, so you've written on a number of subjects. I hope you haven't lost your sense of humor. It doesn't seem like you have, actually, but that's okay. But tell me a little bit about what got you started in terms of advocating for and writing about the whole subject of mental illness.
Probably because the medical treatment and the care that we give to people with mental illness is so bad. If you compare it to heart disease or cancer, everybody shows sympathy. The medical profession goes above and beyond. But when it comes to mental illness, a lot of people are scared by it. They don't understand it. The medical profession really isn't that interested. And I mean, things are getting better. I shouldn't say they're horrible still, but they're not where they should be.
Mm-hmm.
And we have, both in Canada and the US, really cut back on psychiatric beds. So there isn't enough money spent. There aren't enough psychiatrists. People aren't kept in hospital long enough to really stabilize. And then they get kicked out of hospital, and there's nothing for them to do or nowhere to go. And so we see in both countries a huge jump in the number of homeless people, many of them untreated severe mental illness. And that's kind of like saying to a cancer patient, we don't have enough services for you. Go off somewhere and suffer and die.
Is that just because we tend not to understand the whole concept of mental illness? And I think it goes even further. It's mental well-being in general in a lot of ways. I don't think that people really understand how to take care of their own psyche sometimes. We fear so many things, for example, and I'm sure mental illness is one of those things, and we don't we don't deal with it.
I guess a lot of people argue it's the stigma of mental illness. I'm not convinced of that.
Mm-hmm.
Yeah, there's stigma, but when you start talking to people, you discover, oh yeah, my cousin was in the psychiatric hospital, or, I've got this relative that committed suicide. I mean, everybody's got it in their family to some degree or other. But we just have not prioritized it the way we should, and the way we prioritize other diseases. And I think another aspect, too, is self-stigma. People see it as a shame when one of their family develops a severe mental illness, and they don't want to admit it.
Mm-hmm.
So they hide it. And,
yeah, go ahead.
If you look back at HIV/AIDS, that was incredibly stigmatizing when it first developed. But to the credit of the sufferers, they got in everybody's face, and they pushed and they demanded proper care and proper treatment and more research. And HIV/AIDS has now gone from a death sentence to just another chronic illness that's fairly easily managed.
Mm-hmm.
But those of us in the families of the mentally ill have not really done that, and that's to our discredit.
Yeah, it is sad. I think it also goes even beyond mental illness. I know a lot of disabilities, and people with disabilities are treated the same way, especially, well, I won't say especially, but one example is children who are born with a disability, and oftentimes their parents are just totally ashamed and don't really know how to deal with it. I was fortunate in that regard because my parents didn't regard it as anything to be ashamed of, and as a problem that couldn't be solved in terms of not the blindness being the problem, but how people accepted it or didn't accept it, and what I was able to do and not able to do, and I was given opportunities, but they were rare.
Yeah.
And I think that it is certainly true for mental illness in so many ways. I know over the past few years we have had some discussions about the whole concept of end of life, and people consulting and talking and helping people who are growing older and who want to deal with end of life. And some of the medical profession has discouraged that, but no one talks about it.
Yeah, you're right. It's in Canada, unfortunately, we've gone a bit overboard. I've always been a supporter of uh, medically assisted suicide, but now they've gone to the other extreme, and people who could be properly treated or who don't have money um, are finding themselves with no other choice but to apply.
Yeah. And they just don't have anywhere to go. And that's
Yeah,
that's too bad.
yeah.
But, so how long have you been dealing with the whole issue of mental illness, writing about it and so on?
Well, I just realized the other day that it's probably been close to 30 years.
Dating you, huh?
Yeah, I know. You just have to look at my picture.
Oh gosh. Well, still it is a topic that definitely needs to be dealt with in so many ways. Um, but we really just tend to ignore, I think, most anything that is different than we're used to,
Yeah,
especially
exactly.
something that somebody has said is a bad thing, whether it is or not. I don't. No one wishes mental illness on anyone, but still,
Yeah.
understanding is so much more important than going some of the other ways that people go.
Yeah, we don't just shun mental illness. I know of cases where if somebody has cancer, you suddenly lose a lot of your friends. Nobody
Yeah,
wants to talk to you.
yeah,
They're probably afraid of catching it.
yeah. Right. What what can society do? How do we change all of this?
Well, uh, society is, from what I've seen, becoming more understanding. The problem is governments are strapped for money and they make decisions as to who gets how much or for what. And the government, in my humble opinion, just doesn't seem to care.
Mm,
Um, the US and Canada spend far less per capita on mental illness than most of the other OECD countries. We have pretty much the lowest number of hospital beds, psychiatric hospital beds. We don't have enough. I guess what happened when better medication became available and you didn't have to lock somebody up, you could give them medication that took away the delusions and the hallucinations. Um, Governments thought, this is wonderful. We can empty all these psychiatric hospitals, which were just prisons
yeah.
by another name, and they'll be looked after in the community. But then they didn't bother to transfer all those funds to the community. So there are few community treatment programs, little residential care for people. And what we're seeing today with encampments all over North America, 30 to 40% of those people have untreated mental illness. You don't see that in Europe.
Why is that? What is Europe doing, and why are they doing it that we're not?
Well, they're spending more money. They're providing more medical care, residential care. Um, a friend of mine whose wife is Swiss and they visit Switzerland quite frequently. He said to somebody in Switzerland, I don't see homeless people here like I do at home. And the person said, that's because they're all in the hospital getting treatment.
So I guess the question would be, though, if that is the case, how successful are the treatments? Or is like when a lot of them go into those kind of medical facilities, is it sort of something that they end up doing for a good portion of their lives, or what?
Well, they don't have to stay in the hospital indefinitely. Because we have such a shortage of beds, people, when they're quite acute, get brought into the hospital. They're begun on treatment. They make some improvements, but they're not there long enough in order to get fully stabilized to the point where they could be discharged back to the community with regular follow-up care and programming in the community. And that's the big difference.
In Europe, they do.
Yeah. One of the things that I wrote about that had a happy ending was a gentleman in Prince Edward Island who had a psychotic break, refused to go to the hospital, refused to take his medicine, disappeared. His family didn't know where he was. They finally tracked him down to being homeless in Toronto, wandering the streets, sleeping wherever. They managed on 3 occasions to get a judicial order to take him to the hospital for an assessment. And the judge or the justice of the peace signed the orders. The police picked him up, took him to 3 different hospitals where he was kept for varying amounts of time, no longer than 3 days. And they discharged him and said, there's nothing wrong with him. We can't keep him. He doesn't want to stay here. Anyway, they managed to get enough publicity that finally a hospital kept him long enough to get him transferred home, where he was in the hospital for a considerable period of time. And today he's living independently. He's working at least part-time. I think it may be full-time. I'm not sure, I haven't kept track of it. But, he wasn't an uneducated guy. He was well-trained. When he had his breakdown, he was the assistant manager of a bank branch. And if his family hadn't gone to the lengths that they went to get him finally put in the hospital and treated, and then it was actually the press that picked up the story and plastered it all over, and Ontario and Prince Edward Island came to an agreement where he was flown home so he could get lengthier hospitalization. That doesn't happen to the average person.
And even though that was obviously a visible story and one that ended up having a good ending, that's not enough of an object lesson for people that they've made significant changes overall? So things haven't really changed for mental illness based on what happened to him.
No, we make baby steps.
Yeah.
No giant steps forward.
What can medicine and society do? What would you suggest that they do?
Well, I think the medical profession needs to understand more about severe mental illness and what treatment is successful, and get the funding to fulfill that. And the average person, and professionals as well, need to have more literacy when it comes to their knowledge. You can get nurses, social workers, doctors who still have the outdated belief that the mother did something to cause their kid to develop schizophrenia or bipolar disorder. And often they don't want the family involved in the treatment, whereas the families understand what is happening and have full insight into their kids. There's a great deal of education that needs to be done to inform people about the full nature of these illnesses and what is possible.
Are conditions such as schizophrenia and bipolar, since you mentioned it, are those really caused by anything? Is it genetic? How does that come about?
That's the $64,000 question. There are many theories. It's probably a combination of genetics and environmental factors. With schizophrenia, it doesn't start showing until 18 to 25 for males and a little later for females. And there are all sorts of theories. There are all sorts of genetic causes that have been discovered, but there's no one gene that anybody can point to and say this is the definitive cause. It's just many things.
So no one has really come up with something. Is there a lot of research into it? Does there need to be more research? Does anyone have yet any kind of inkling where it might be going?
There's a fair bit of genetic research, and various things that are being looked at. There was a fair bit of drug development because there are some drugs that are quite helpful at times, but nothing really definitive yet. They can help somebody. They can deal with the worst of the symptoms. But one of the biggest problems is cognitive loss. And there's nothing that touches that yet. So it's all drug development, and it's slowed down in the last few years. I think it's starting up again, but...
Is there any kind of study that shows whether or not incidences of different kinds of mental illnesses like schizophrenia and so on are less in Europe because of the better work or the more proactive work they do to bring people into hospitals and so on, or is statistically it really the same as it is here in the United States and Canada?
The incidence is pretty much stable. I think it's, 1 in 100 for schizophrenia. And it really hasn't changed in years. You can look at a disease like multiple sclerosis, which has a much higher incidence in Canada than in anywhere else in the world for some strange reason. Nobody knows why. But with schizophrenia and bipolar disorder, the incidence is pretty stable throughout the world.
So I'd have a hard time convincing you that the incidences of MS are higher in Canada because Mr. Green Jeans closed? just checking.
Yeah, actually, I think it's Manitoba that has the highest incidence.
See, and they didn't have a Mr. Green Jeans there. I rest my case.
That could be, yes.
Yeah, I understand that. That's interesting. I didn't know that statistic. That's interesting and sad. I would presume that there are some people trying to study and figure that out.
Oh, yeah, there's quite a bit of research on MS, but from what I recall, I don't think much progress has been made.
I know that blind people who use guide dogs, I don't know that they're all necessarily aware, but a number of guide dogs have gotten cancer, and I think it's been increasing some.
Oh, really?
But nobody seems to know why. And they've done a number of tests, and no one has been able to figure out yet why so many dogs have exhibited some sort of cancer. It's an interesting thing, and it's an unfortunate thing, of course. They don't obviously start out with it, but a number are getting it, and it's really too bad.
Yeah, that's interesting.
And some people thought maybe it was like at Guide Dogs for the Blind, which is one of the in San Rafael, one of the places where I think that they decided that there's a higher incidence than other places. They've checked the water. They've checked so many things. I don't know whether anyone, it's been a while since I've talked to anyone about it, but nobody has come up with any solution to it. Medical science has got a long way to go about learning about so many different things, doesn't it?
Oh, yeah. I mean, when you come right down to it, the advances in medicine are not that great. Sanitary conditions, antibiotics, surgery. But beyond that, there's a lot that nobody knows anything about.
Do you think that AI will help in some of those kinds of things going forward? And the reason I asked is I know that the Moderna vaccines for COVID and the vaccination protocols that people are using was largely developed because of AI, and it happened so much quicker because of AI than it otherwise would have.
Yeah, it's possible. I've just started playing with that, and I find that I was skeptical at first. But then I discovered that the AI gizmos, whatever, could put together a lot more research a lot faster than I could do.
Yeah. Well, and that's the issue, right? It is a tool. Like with anything, people can misuse it and do, but also it is a really good tool for good. I use it when I write because it gives me interesting ideas that I hadn't thought of, and I will use it. But ultimately, when I create something, it still has to be my creation that comes out of all of it, and I think that's as it should be. But I think AI can help in so many ways, and it will, I think, over time only get better.
Yeah, hopefully. For good.
Yeah, for good. Well, that's the issue. And of course, it depends on, like with anything, on how different people use it. And I think that anytime you develop safeguards, other people are there trying to counteract that. And, well, the internet's the same way. I believe the internet is a wonderful treasure trove of information, but there are people who misuse the internet. The dark web is there and so on. And we have so many different kinds of things that we face and we deal with. But I think overall, it's going to come down to the ethics and the morality of people that are going to succeed or not.
Yeah, and there's not much of that these days, is there?
Doesn't seem to be, does there? Well, I wrote a book called Live Like a Guide Dog, and it's all about lessons I have learned from my 8 guide dogs and my wife's service dogs about dealing with controlling fear and just living life in general. And I still maintain I've learned so much more from observing 8 guide dogs over the past 65 years than I've learned from all the management theorists and experts around, just because of the way dogs live. And there's a lot of value that we could get from that.
Yeah, my philosophy is dogs were put on the earth to teach us how we should treat each other.
Yeah.
And we're too stupid to pay attention to them.
We are. I think there's a lot of value in living in the moment. And dogs don't do what if. Everybody does what if all the time about everything under the sun. And that's enough to cause mental illness right there.
That's true. And dogs give unconditional love.
I do believe that. I think that dogs do love unconditionally, but dogs don't trust unconditionally. And I think that's the interesting aspect of it. But dogs, unless they're just so severely traumatized, when there are some who are, but dogs generally, while they don't trust unconditionally, they're open to trust. They want to develop a trusting relationship.
Yeah.
And I think learning from now 8 guide dogs, I think it takes a good year to truly develop the level of trust that needs to exist in a guide dog person team. But the dogs are open to it, and that's so much that we can learn from that.
Yeah, I mean, I don't trust anybody that a dog does not like.
Yeah.
Or doesn't like dogs.
Oh, yeah. Well, and that's the issue. Now, there are some people who are legitimately allergic, but that's not the same. There are also a lot of people who try to use allergies as excuses in this country, and I would presume in Canada and other places as well. There are a lot of people who, for example, work for Uber, and they say, I can't have a dog in my car, I'm allergic. Well, allergy doesn't trump providing the service of transporting a person with a service animal. There are very few people who are so allergic that it truly is a medical condition that they have to be worried about. But yeah, nevertheless, people try to do it like with everything all the time.
Right, yeah.
And then you have dogs like my dog who would be very happy to sit on anyone's lap at any time.
Well, they're looking for food, right?
No, they're looking for attention and just friendship. Well, if food comes along, he's not going to refuse it. But no, he thinks he's a lap dog. The first day I got him, when I was at Guide Dogs for the Blind, I sat on the floor and I thought I was just going to pet him. He was going to lay down in front of me. The next thing I know, he's totally all of him in my lap. I didn't expect that at all. That was great.
And he was a big dog, right?
He's a Labrador.
Oh, jeez, yeah.
He's over here on the bed, but he's a 63-pound Labrador.
Wow.
And thinks he's a lap dog. He's gone into airplanes, and I've taken him up to the cockpit, and he's jumped on pilots' laps when they don't pay attention to him. We've got pictures. It really is cute, but there's so much that we can learn, as you pointed out, from the dogs, and we all ought to be at least open to trust. And somebody might not earn our trust. Okay, then we deal with that and we move on, and we don't trust that person. But on the other hand, I think people innately do know when somebody's open to trust, whether they're willing to really pay attention and deal with that and trust back is another story. But I think most people really like to see the good in people and tend to trust at least some. But I think that with everything going on, especially with what our politicians are doing today, they're not doing anything to teach us how to be trusting.
No, that's for sure.
And it's unfortunate. I won't go into whether they have mental illness or not. That's a different story. But they certainly don't engender trust.
Right.
Which is really too bad. But nevertheless, I think we really can learn a lot from them. But it's a process. So, do you think that there's an innately or an extremely high incidence of mental illness among people who are homeless, and why is that, if that's the case?
Yeah, they've done surveys, and the numbers vary, but I've read 30 to 40% of people have untreated mental illness who are living on the streets. And some of them have addiction issues along with that, which sadly is not surprising. And some of them just have addiction problems.
Mm-hmm.
So that makes up a good chunk of the homeless population.
And of course, again, how do we deal with that?
Well, there are all sorts of ideas. None of them are really working out that well. I know California has taken a very liberal position of let's just give them a place to live, and that hasn't worked out too well.
Yeah.
The Portuguese seem to have the best solution in that they've decriminalized drug use, but they very strongly recommend and push people towards going into recovery. But we can't do that because we don't have enough recovery programs for people.
We don't have the facilities, yeah.
And besides, even though we have universal health care in Canada, drug treatment is usually private companies, and you can pay tens of thousands of dollars to go somewhere to dry out and get off drugs.
Mm-hmm. So drug treatment as such is not really well covered under the universal health care system in Canada? Uh-huh.
No, and it should be.
Mm-hmm. And it certainly isn't anymore here either.
Yeah.
In the U.S.
So, our governments can't complain about the homeless people on the streets because they ain't doing nothing to solve it.
How do we solve the homeless problem?
Well, again, the Europeans have done an excellent job. Some of the Scandinavian countries, and I'm not an expert on them, but I know they don't have homeless people, or at least to the extent that we do, because when there is somebody who is homeless, they match them up with treatment professionals, and they get treatment for them for whatever ails them, and it's often drug addiction or mental illness. And they help them get places to live that they can afford, and they help them get training if they need that to hold down a job.
Yeah, because certainly there are people who are homeless who don't have addiction issues or have mental illness. It's just circumstances.
Right.
And I don't see here that that's treated any different than anything else. And what you're saying is that it is a little bit of a different situation as to how it's handled in Europe.
We don't really treat it. You're right. There are people who lose their job. They get evicted. They need help, and they don't get it. But they don't have a mental illness or an addiction.
Right.
So, like, there are sort of 3 or 4 categories of homeless people.
Right.
And we don't really treat any of them the way we should be.
Yeah, and that's really the issue. We just here lump it all together mostly.
Yeah. One of my articles, I suggested that Justin Trudeau, when he was Prime Minister, take a trip to Finland and see what they're doing there. Because whatever he was doing was just wasting money if he spent any, and was not accomplishing anything. You know, and I've always been of the belief that if you want to do something, find somebody who's already done it or is doing it and learn from them. Don't try to reinvent it.
Uh-huh. Well, and yeah, I don't know how we get people to change their mindset and their attitudes about it. Because I think you're right. A lot of it does come down to shame in one way or another. But we've got to get over that, and I don't know how in the world we do it.
Yeah. Education, publicity, propaganda.
Let dogs visit everybody, and it'll work out better.
True enough.
Well, and there is truth to the fact that I know at some colleges there are dogs like during finals week who go around and visit students, and it makes people feel comfortable. But, you know, a dog isn't going to be the overall end solution to it either. But it is true that they can certainly help. Emotional support animals are not service animals under the law, but they do serve a purpose. The difference, of course, is they're not trained, and service animals are. But still, there's so much that can be done that isn't being done. And dogs help. I have a cat. I don't know whether my cat would be very helpful, but the dogs are.
No, cats are a different animal.
They have their own mindset.
Yes.
I think they really do believe that dogs have masters and cats have staff, and so, you know, you got to live with it.
Yep, I've seen that.
It's the way it is. But still, we make progress. So what? So you've written obviously a number of articles on mental illness and so on. What kind of writing have you done on other kinds of subjects or in other kinds of media? What other sorts of things have you done?
Well, when I was actively freelancing, I'd be writing about cardiology, oncology, ophthalmology, neurology. So I've written a great deal about a lot of other topics, which frankly, at the time, I knew nothing about. But, you know.
You learn.
Exactly.
And then you put that knowledge down on paper, and hopefully that helps other people, as I assume what you're thinking.
Yeah.
Mm-hmm. What got you to write on cardiology? That's a lot different than other things that you've been talking about.
Well, when I was actively freelancing, I would get hired to go to various medical conferences and write about some of the papers that were presented there. So I've been to medical conferences all over North America and Europe, and often a doctor's name would appear on what I wrote, so they would vet what I wrote to make sure it was correct. But, it's all possible.
Right.
And I learned a great deal. That was the fascinating part. So I've been in the ER and start talking to a doctor, and they pause and say, "Are you a doctor?" I said, "No, I'm a writer. I don't know what the hell I'm talking about."
And they say, "You could have fooled me."
But you also learn what the standard reference sources are.
Sure.
So you know where to get the research.
So you said when you were freelancing, you don't freelance nowadays?
No, I just, I have a weekly blog, which is mostly on mental illness, which I write with a friend who's a retired psychiatrist. So I'll write, he'll write, and, we have a fairly respectable following. And that's quite a lot of fun, and I think we do make an impact.
Well, I think that's kind of really important to be able to do. So are you mostly retired these days, or do you have other things you do?
Yeah, I'm old enough to not have to go and chase a paycheck all the time.
That's a good thing. But you've obviously contributed a lot to the world in so many different ways, I guess. What's the biggest disappointment you think you've had in terms of publishing?
Oh, I'm glad you asked that question. One of the books I published, which was peripherally on mental illness, was a book by a Toronto teacher who became a psychotherapist. And she was a child of Holocaust survivors. And there was a lot of evidence from that time forward that kids of parents who suffered a lot of trauma, that trauma was passed down to them.
Mm-hmm.
And so she wrote a book about growing up as a child of Holocaust survivors in Toronto in the 50s and 60s, which she interspersed with her parents' experiences in Europe. And it was a beautifully written book. And I think for what's going on in the world today, it's a very poignant, valuable story to tell. But it got good reviews, but it didn't sell well. And people would say to me, "Why are you publishing a book on the Holocaust? Who cares about it anymore?" Well, it's history, and we should care.
Yeah.
Because it's still happening in all sorts of countries. So, the book is called When Their Memories Became Mine. And it, as I say, it's beautifully written. I can say that because I didn't write it.
Okay.
She was an English teacher and a drama teacher, and she had a very good way with words. And I was hoping it would make an impact. But any impact it made was really quite minimal.
That's so sad. Well,
and it's still available.
Okay. And it was When Their Memories become mine or meet mine?
When their memories became mine.
Became mine. Okay.
Yeah. And the author is Pearl Goodman.
Okay. Now let's turn it around and go the other way. What do you think your greatest success in publishing has been?
My authors have all been fantastic and have all gotten tremendous accolades. So the books on mental illness they've written have been highly recommended in Europe, in the U.S. by groups like the National Alliance for Mental Illness, Healthy Place, which is in Texas, Mood Disorders of Canada. Two of my authors have won Courage to Come Back awards in Vancouver for the books they wrote about their recovering and coping with the serious mental illness. One of them became one of the 5 faces of mental illness in Canada a few years ago. And my American authors have lectured in all over the States at medical psychiatric conferences. So if I may put in a plug, it's Bridge Ross Communications. And you can find the books are still in print there, and in print and in Kindle versions.
So it's Bridge Ross.
Yeah, one word.
Productions. Okay.
Bridge Ross Communications.
Communications, I'm sorry. Bridge Ross Communications, right. Well, I think absolutely it's appropriate to do that. If people want to reach out to you, how do they do that?
You can just Google my name.
Marvin Ross.
Marvin Ross, Dundas, Ontario. Or my website is bridgeross.com.
Okay.
And I'm on LinkedIn, Facebook. And my blog is called Mind You, which should be easy for you to remember.
We try. So Mind, Y-O-U?
Yeah, exactly.
Okay. Got it.
There's a subtitle after that. I can't remember what it is.
That's all right.
It's on WordPress at any rate.
Well, this has been absolutely lovely to have done. I really appreciate you being here and giving us the opportunity to chat for an hour. It's been fun, and already an hour. Can you believe it? So
it's been fun. I didn't think I would have so much to say, but you pulled it out of me.
Well, I hope everyone out there appreciates it. We'd love to hear from you. You can certainly reach out to Marvin. I hope you will. I'd love to hear your thoughts. Please feel free to email me at michaelhi@accessibe.com.
Right, and I've got your email address. It's on in my email list.
Well, and I give it every week. So I hope people will write me and let me know what they think. Wherever you all are, I hope that you'll give us a 5-star rating on whatever podcast medium you're listening or watching us on. But also, please give us a review. We really value your reviews. Of course, we love really 5-star reviews, but give us a review. We'd love to hear your thoughts. And if you know anyone who ought to be a guest on our podcast, because I believe everyone has a story to tell, please introduce us. Marvin as well. If you know anyone who you think ought to be a guest, we'd love to have you.
Be happy to do that.
Great. But in the meanwhile, I just want to thank you once more for being here. This has been absolutely delightful. So thank you.
Yeah, and thank you for the opportunity. I've quite enjoyed it.
If you're ready to go deeper into the ideas that shape how we see ourselves and others, I have a free gift for you. Head over to michaelhingson.com and download my free ebook, Blinded by Fear. Keep learning, keep questioning, and keep choosing to live with an unstoppable mindset.